Good day, everyone. Our topic for today is the physical and sexual self. Physiology of human sexual response. Sexual response follows a pattern of sequential stages of phases when sexual activity is continued. Excitement phase. Arousal is a physiological response triggered by increased pulse and blood pressure, resulting in skin temperature, flushing, swelling, rapid breathing, genital fluid secretion, vaginal expansion, and muscle tension, leading to the next stage. Arousal means is a state which you feel excited or very alert, for example, as a result of fear, stress, or anger. In the excitement phase, the body prepares for sexual activity by tensing muscle tensions and increasing heart rate, blood pressure. In the male, blood flows into the penis, causing it to become erect. In the females, the vaginal wall becomes moist, the inner part of the vagina becomes wider, and the clitoris enlarged. The characteristic of the exciting phase, which can last from a few minutes to several hours, include the following: muscle tension increase, heart rate weakens, and breathing is accelerated. Skin may become flushed or blotch of redness appears on the chest and back. Rate to pace. It is generally of brief duration if stimulation is continued. Orgasm usually occurs. What is orgasm? Orgasm does many things to help boost a woman's fertility. Examples include increasing the chance of pregnancy at any point during a woman's cycle, drawing in more sperms, and boosting the immune system to help assist with fixation. The play-to phase intensifies the responses from the excitement phase. Breathing, blood flow, and heart rate continue to increase and stabilize. Muscle tension increase and may extend to hand, feet, face, and other areas of the body. The play-to phase breathing becomes more rapid and the muscle continue to tense. The gland at the head of the penis swells and the testes enlarge in the females. In females, the outer vagina contracts and the clitoris retracts. Sexual climax. It is marked by a feeling of abrupt, intense pleasure, a rapid increase in pulse rate and blood pressure, and spasms of the pelvic muscles, causing contraction of the female reproductive organ, and ejaculation by the male. It is also characterized by involuntary vocalizations. Sexual climax may last for a few seconds, normally not even 10, after which the individual enters the resolution phase. Orgasm or sexual climax is the sudden discharge of accumulated sexual excitement during the sexual response cycle, resulting in rhythmic involuntary muscular contraction in pelvic region. Characterized by sexual pleasure, it's the shortest of the phases and generally lasts only a few seconds. Ge- General characteristics of this phase include the following: involuntary muscle contractions begin. Resolution phase. The final stage refers to the return to normal or subnormal physiologic state. with males returning to normal even with the stimulation, while females can perform repeated orgasms without rest period. During this phase, the body slowly returns to its normal level of functioning and swell and erect. Body parts return to their previous size and color. This phase is marked in some by a general sense of well-being and often fatigue. The succeeding resolution phase brings back a gradual return to the resting state that may take several hours in the males. The penis shrinks back to its normal size. In the female, the vagina and other genital structures also return to their pre-excitement condition. What is pre-excitement condition? Refer to early activation of ventricles due to impulse bypassing the AV node via AP, is also known as bypass tract. APS are abnormal conduction pathways formed during cardiac development and exist in a variety of anatomical locations, and in some people they may be multiple pathways. Nervous system factor. The entire nervous system plays a significant role in during a sexual response. The autonomic system is involved in controlling the involuntary responses. The presence of the stimulus capable enough of initiating a sexual response. The efferent cerebrospinal nerves transmit the sensory messages to the brain. Hence, sexual response is dependent on the activity of the nervous system. The hypothalamus and the limbic system are the parts of the brain believed to be responsible for regulating the sexual response. But there is no specialized sex center that has been located in the human brain. Normally, one response pattern is dominant and the other latent can still be initiated when suitable circumstances occurs. The degree to which such innate patterns exist in humans is still unknown. Known part of the brain controls sexual responses. There is some reflex, not brain control, sexual response. For example, if you touch a hot stove, the nerve in your skin shoot a message of pain to your brain. The brain then sends the message back telling the muscle in your hand to pull away. Sexual problems. Fortunately, most physiological sexual problems can be resolved through medication or surgery, while problems of the nervous system that can affect sexual response are more difficult to treat. Physiological problems comprise by far the largest category. They are usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, and sexual myths held by society. Fear of being impotent frequently causes impotence, and in many cases, the afflicted male is simply caught up in self-perpetuating problem that can be solved only by achieving a successful act, act of coitus. In other cases, the impotence may be a result of dis- disinterest in the sexual partners, fatigue, and distraction because of non-sexual worries. Intoxication or other causes such as occasional impotence is common and requires no therapy. Ejaculatory impotence, which results from the inability to ejaculate in coitus, is uncommon and is usually phycogenic origin. Some examples of male sexual dysfunction include erectile dysfunction, orgasm or ejaculation disorder, and priapism or painful erection. In females, sexual problems include loss of interest in sex, difficulty reaching orgasm, negative thoughts during sex, and vaginal dryness and tightness causing painful intercourse. One of the examples of painful erections is what we call hematospermia or blood in semen. The cause of the hematospermia is the blood in semen that be caused by inflammation, infection, blockage, or injury anywhere in the male reproductive system, include the testicle, epidermis, vas deferens, seminal vesicle, and prostate glands. And the treatment of the hematospermia is that the treatment for blood in the semen depends on the underlying causes. Sometimes it is just a isolated event with no other symptoms or underlying causes and no treatment is needed. If it is caused by an infection, you may need antibiotics. If an enlarged prostate is a cause of the blood, there are medicine that helps to shrink the prostate, but this may take several months. If blood in the semen is an after effect of procedure while vasectomy, you will have been advised what to expect. For example, after a prostate biopsy, it may take up to 20 ejaculations before it cleans up. If the cause is a blockage of a crease or deposit of calcifications, the urologist may clear or remove this keyhole surgery guided by ultrasound. Prostate cancer is treated with surgery, radiation, or hormonal therapy. The human sexual response is a series of stages, including the excitement phase, breakthrough phase, sexual climax, and resolution phase. The nervous system plays a crucial role in regulating these responses, with the hypothalamus and limbic system transmitting sensory messages to the brain. However, there is no specialized sex center in the human brain. Typically, one response pattern is dominant, while the other can be initiated when suitable circumstances occur. Sexual problems can be resolved through medication or surgery, while nervous system issues can be more difficult to treat. These problems are often caused by socially induced inhibition, maladaptive attitudes, ignorance, and sexual myth. Impotence can result from fear of being impotent, disinterest in the sexual partner, fatigue, distraction, or other causes. Ejaculatory impotence is uncommon and usually of physiogenic origin. Thank you, that's all. Thank you for listening.